Hi, this is Becky Sanders, Program Director of the Upper Midwest Telehealth Resource Center. Thank you for joining us today for our webinar in our UMTRC webinar series. Today we're going to hear from Randy McLeod, who is Account Executive at onsite Telepsychiatry, and be talking about telepsychiatry programs today. So Randy, go ahead and take it away.
Wonderful. Well, thank you very much, Becky, for the introduction. And I'm actually probably going to turn off my video here so we can just focus strictly on the slide deck. But I want to give you guys a chance to actually see that I'm, speaking with all of you guys live. I also realized that the picture that I see on my slide deck that I've been using, that's from probably 4 years ago. I'm looking at it thinking I look a little bit younger than I do now, and I'm guessing it has something to do with my 2-year-old daughter keeping me up at night. So that's something that I need to change. But very excited to be talking with you guys today about telepsychiatry specifically, and how to set up a successful telepsychiatry program within your organization. So let's go ahead and get started. So I'm going to stop my video. All right, so a little bit about me before I guess we really get into this, so you kind of understand my background. Physically, I am located in the state of Michigan. I live right outside of Lansing, Michigan. I actually have been working within behavioral health for probably close to the last 14 years. I've got lots of experience working in standalone outpatient clinics. Did some work here in Michigan in the community mental health organization, so I understand how they operate. And then actually I went to school at Western Michigan University, and I got a bachelor's degree in interdisciplinary health services. And from there, actually, my wife and I, we moved to Arizona. My wife is a teacher, and she got a teaching job that she was offered, so we kind of uprooted our lives and we moved to Arizona. And while in Arizona, I was actually a program manager for a child and adolescent crisis assessment center, which was located halfway between Phoenix and Tucson. Extremely rural, lack of psychiatry shortage in that area as well. So oddly enough, we turned to telepsychiatry. The program was ran, so we took referrals from hospitals, we took referrals from parents and from schools. It was just a short-term program for kids to have a psychiatric intervention to then hopefully return to the next best level of care, ideally that being going home. But we turned to telepsychiatry, and so I actually had a chance to see how it operated, from an executive standpoint, to kind of see how all the staff took to it. But I also got to see how all of the children in the program took to telepsychiatry. And to be very honest with you, I was a little skeptical in the beginning on how all of it was going to work. But also keep in mind, this was probably at least six to 7 years ago, and telemedicine and telepsychiatry specifically has come a long way since then. But ever since then, I've been a true champion of what telepsychiatry is able to offer. Outpatient clinics and hospitals and correctional settings, and really any place where behavioral health touches. But when I moved back to Michigan, I said, that telepsychiatry stuff, that was pretty cool that I was doing in Arizona. I wonder what I can do with that now. So I actually reached out to onsite, and I've been with onsite as the account executive for about the past 4.5 years. So it's been an exciting time within telemedicine, and telepsychiatry is really no different than that. So let's go ahead and just jump into it. So with the agenda today, I want to just kind of give a telepsychiatry overview, and then jump into kind of how telepsychiatry is used. And that's a funny bullet point, because 4 years ago, it seemed like I was doing a heck of a lot more education on what telepsychiatry is. And these days, it's more my conversations around the details of, all right, we know what telepsychiatry is, we know what telebehavioral health is, how can it work for my organization? So I think that's also important to know that the field of telemedicine is really making a lot of strides. We're also going to touch on program planning, and then also the telepsychiatry best practices. So telepsychiatry, and this is actually a funny slide to me. I was actually having a conversation this morning You can see obviously that psychiatry is bolded here on this shot. I think that we are, in general, we've come a long way in terms of telemedicine and telehealthcare. That give it some time here in the near future where people are just going to totally focus on the word psychiatry or strictly focus on the word medicine, and that tele is going to be removed. I think so many organizations, whether it's outpatient or hospitals or corrections, they're soon here, they're going to be taking away that tele part of that word, and it's simply just going to be healthcare. I think that we're definitely getting close to that, but for right now, it really is just a medium for delivering services, all through video conferencing. I think it's important to know when people think about telemedicine, it's kind of a broad term, but when we look at telepsychiatry specifically, it is quite different from other services. With telepsychiatry, we focus on the conversation, and we're collecting quite a bit of information from our patients and the organizations that we work with. We're really striving for long-term physician-patient relationships, especially in the outpatient market. Usually there can be anywhere from 8 to 12 appointments, and usually how that starts is with the initial psychiatric evaluation followed up by medication management appointments, and multiple types of appointments. So here we're talking about physician-patient relationships. We're talking about a provider carrying a caseload of patients, and before they know it, the patient and the physician, they do have that relationship. That's Dr. Smith, the psychiatrist, that has been caring for that patient for the past 3 to 4 years. So it really is the relationship that gets built between the patient and the physician, and also likewise between that physician and that clinic. There are other branches of telehealth. If we want to talk about maybe teleradiology, that was one of the first ones many years ago with groups like Nighthawk. There's also telestroke, teledermatology, just to name a few. We're talking about where they're focusing really on observation and those short-term encounters when necessary. It's most time it's just a single consultation just for a provider, maybe to review some x-rays or to review a patient just one time, and then they're going to go about it because it's more just physical health, like I mentioned, which is obviously different from telepsychiatry where we're building that relationship. Some of the benefits to think about within telebehavioral health is you need to really look at 3 different things. With one avenue, we are looking at the consumer. With the other, we are looking at telemental health, the provider themselves, and then also how telemedicine and specifically telebehavioral health can affect a community. To really look at the consumer, it's really benefiting the consumer by reducing time in the hospital. We've all heard those kind of nightmare stories of psych patients waiting in the ED, for example, or even after they're admitted onto the unit, waiting for a behavioral health clinician, a psychiatrist, an APN to actually be able to evaluate them. So it's really helping them out in that manner. It's really providing access to specialties. For example, child and adolescent psychiatry. We all know that those providers are kind of few and far between. It really helps with providing access to that provider for that population. And the same thing really kind of goes for the geriatric population or substance abuse specialties. It's also very flexible in terms of scheduling. A number of our providers, they like to have their full-time job, during the work week, but they like to provide telepsychiatry on the nights and on the weekends. That helps for, busy professionals that also have jobs and they want to have their psychiatry appointment maybe after they get out of work, but normal business hours would be closed. So this is kind of helpful in kind of being able to touch more endpoints with provider availability. It all facilitates a continuity of care where you can not only provide services, if we saw a patient in the hospital emergency department, we could also see that patient in a community outpatient clinic or possibly even at home, depending on the setting. I already mentioned the reducing of the wait times, for example, in EDs, but also the same thing kind of goes for the outpatient clinic by augmenting and blending telepsychiatry services into the already existing psychiatry services in an outpatient clinic. It really can kind of free up the provider that's working on site to help patients, maybe instead of being seen every 8 to 10 months, they can stay on top of their medications every 4 to 6 months, for example. And also very high consumer and family satisfaction. For the provider, it increases time and efficiency. They can focus specifically on the patients that they are seeing. It can decrease transportation costs for the provider, where they can be providing services directly from their home or from their outpatient practice. They can also increase the number of visits, improves communication and collaboration with the on-site team and also with the patients. The ability to see a diverse consumer population. And this is an important one. Sometimes providers, they might be certified in child and adolescent psychiatry, but they also like to see substance abuse patients, or maybe they also like to see just the general adult population, or maybe they specialize in a certain mental illness where they can really kind of focus in on what they're passionate about, and also just be able to see additional patients. And also there's lots of flexibility to work from home. It seems like it's very popular with folks who have recently retired, but they want to stay within the field of psychiatry. It seems to be very popular for students who are fresh out of school, and they want to kind of jump on the new kind of cutting edge ways of where healthcare is going. It's also very popular for new moms who've got a young family at home, or they have a new baby at home, and they want to be able to kind of balance that work and life balance, where they can spend more time with their family. They don't have to drive an hour into the clinic each day, but they can be able to hold on to their patient caseload just by staying at home and being able to see them. It really will benefit the community. It's increasing access to specialties, which is extremely beneficial. Reduces the inappropriate admissions. That's a pretty common thread here. And it connects the siloed healthcare organizations. For so long, many hospitals and outpatient clinics within certain cities, they're really worried about themselves. And so this is really a nice way to really kind of look at all the problematic areas within outpatient clinics and hospitals, and really bring them together with a lot of hand-holding and the avenue of using teleconferencing and telemedicine software and hardware to really kind of hold each other's hands a little bit better, and really remove that siloed approach. Because ultimately, we're all in this game together. We all understand the problems that we're having with lack of access to psychiatry, and it really kind of breaks down those walls and those barriers to help people work a little bit more together to really strengthen the mental health within a community, which is obviously very important. It also reduces the risks and liabilities, knowing that you have access points within telepsychiatry, not only in the hospital, but the outpatient clinics, and having access to primary care providers. It really can bring the right specialty of care to the settings that need it the most. So I touched on some of these earlier, but the populations that are really benefiting here, they are the busy parents, the folks who can't get their kids in to see the provider during business hours. With children, bringing in that specialty provider. College students, even some of them are receiving telepsychiatry and teletherapy right in their dorm room, because their provider is actually a teleprovider. And so it doesn't really matter where the patient is. Maybe they used to go see them in their outpatient clinic, but since they moved away to college, they can access their provider by using a HIPAA compliant software, which is obviously very important. The aging population, if they are in a nursing home or a skilled nursing facility, they are able to gain access to a geriatric provider, and it doesn't even matter what location they're in. Couples therapy is huge. The traveling executives, the physically disabled or the ill, homebound due to their mental health issue. Rural areas, that's pretty obvious. We all know many areas are, the closest psychiatrist or psychiatric APN might be 4 hours away, and it'd be impossible for them to get around, especially if the weather's bad here in the Midwest in the winter time. So it's nice to be able to really do more with less. You can imagine if we were expecting a provider to touch at all these points within hospitals and outpatient clinics and skilled nursing facilities, it'd be really pretty much impossible to share all that provider time with all of the logistics around trying to travel. So it's nice to be able to use this medium to provide psychiatric care to make sure that all the ends are being met. In the triple aim, I think this is something really important. We all understand what the triple aim is. We're really trying to improve the consumer experience through telepsychiatry. we're improving population health, and we're also reducing the cost of the system. We all know that psychiatric patients, within many organizations can be very costly, and especially within standalone hospitals and healthcare systems. So the do more with less mentality is extremely important here, and it's a great way to impact the triple aim. There are some challenges within telemedicine, and really telepsychiatry is no different. The programs themselves, whether it's the hospital or the outpatient clinic, always constantly trying to comply with the multiple state and federal regulations, getting buy-in from a new program, and then also the designing efficient workflows. Workflows are going to be different really wherever telepsychiatry is being provided, but it's important to really understand, and really look at kind of what are you folks currently doing now for to have your psychiatry needs met, and how will telepsychiatry almost mimic that? It's a great way to kind of make improvements all without removing your on-site services. Some of the challenges for the providers themselves is, they really need to be able to have licensure in multiple states, and there's all the nuances that kind of go along with that as well. They also must make time to interact with the on-site staff, and also the potential to feel isolated. And I'll talk more about this later, but it's really important for the provider, even though they're working remotely. And just an example here would be, let's say that there is a psychiatrist who's physically located in Florida, but they are providing services to an outpatient clinic in Wisconsin. They might have most of their clinic day all filled up with initial psych evals and medication management of the patient population that is served there. Sometimes they need that other interaction with the staff who is on site, so they really feel like they're a part of that team. So I would definitely recommend the folks that are interested in making a successful partnership with a telepsychiatrist is to really do some hand holding and make them feel like they are more than just there to see the patients. Maybe they can provide some clinical supervision to other staff. Maybe you could invite them to participate in your staff meetings. Maybe you could, and obviously scheduling would be a big part of that, but really the idea here is to use them more than just seeing patients. How telepsychiatry is used. So when it comes to telepsychiatry, this is one of the beautiful things and kind of really exciting things about telepsychiatry is you really start to look at all the different organizations and facilities, across the country where, somebody who is struggling with a behavioral health illness might end up. Just to run through these real quick, outpatient clinics, in the home, primary care offices, the ED, the med surgical unit, psychiatric inpatient units, urgent care centers, mobile health clinics, CMHCs, federally qualified health centers, some ACT programs, residential programs, schools, corrections, and skilled nursing facilities. It's really kind of what I touched on before. Like if we were trying to have either one provider or a few providers within a community trying to touch all of these bullet points, physically being on site, it might be a little bit impossible to make sure that they are not only getting to all these bullet points, but also that they are able to give the patients the level of care that they really deserve. That's why it's really nice to kind of be able to blend and augment telepsychiatry services into these different programs, and it's not ever about replacing on-site care. We definitely understand the importance of on-site care, so it's really about relieving the workload of those providers that are on-site or bringing access to specialty care within a community to touch it and really kind of understand and blend with some of these additional settings throughout communities. Here at Insight, and this is, I really can't speak for any other telepsychiatry organization, but I'll just, keep this as educational as possible. We have a model that is our scheduled services model. This is where, remote providers are really carrying a caseload of patients. This is where they are able to see the patient for the very first time and provide that initial psychiatric eval. I touched on it earlier, but the idea of scheduling where they can be a part of the treatment team meeting, so they really have a chance to interact with the the on-site team to, talk with the case managers and the social workers and the therapists, but also along with the patients and their families. It's extremely important. A big part of what our providers do anyways is they also participate in the ongoing treatment of the patients, where they are providing medication management appointments, so they're able to see the patient after the initial psych eval. You can also do a lot of therapy and counseling, and then also the group sessions. It's really about, like as I mentioned, where we're holding a case log of patients, and it's scheduled accordingly. There's also a model of care, and this is mostly popular, on-demand telepsychiatry. You could think about this as being best utilized in, crisis assessment centers or hospital emergency departments. Sometimes some correctional facilities will use crisis telepsychiatry. The idea here is where you really need psychiatry intervention and you need it quickly. That's where, a crisis telepsychiatrist would be able to provide a psychiatric assessment. They could help you in the ED. If the disposition is a little bit unclear, they can help with admission and commitment decisions. One thing to keep in mind is every state is a little bit different in what they will accept for admissions through telepsychiatry. So that's something to think about and really kind of nail down before you kind of take that step. They can assist with consults and orders. They can round within an ED. They can also round within a psychiatric inpatient unit. And they can also make referrals on, should this person, go to an inpatient unit, or should they be able to go home? A psychiatrist is very well versed to be able to make that decision and can really help out, other levels of specialty physicians when disposition is unclear. This is one of, I should say one of Insight's newer models of care. It's our direct-to-consumer model. It's the value added for the consumers, the flexibility of providers and of the patients it's very beneficial. It's a great way for to continue patient and physician relationships despite where each one of them is physically located, and you can really expand care to almost anywhere. And this is just a little screen that I like to pop up just to kind of look at all the different areas where telepsychiatry can benefit, from hospitals to lockdown facilities to outpatient clinics and schools, the treatment team meetings. The opportunities are pretty much endless. So now to talk a little bit about program planning. I think, there's a lot of things that you really need to kind of consider before you kind of really, go into the launch of this. You really need to look at the state that you are currently in and consider the regulatory and legal environment. You want to make sure that you are doing everything right with the bylaws and how telemedicine is approved within your state. And that's something that Becky and her team can really help with, really understanding the telemedicine landscape within your state. You also need to cultivate stakeholder buy-in, and that goes all the way from, folks in your community to the leadership of your organizations, to really have folks champion the idea that, the telepsychiatry could really impact, how psychiatry is served within your organization. Also selecting technology. And this is kind of a funny one because, 4+ years ago when I first started, we were really talking about some pretty fancy telemedicine equipment to be able to provide telepsychiatry services. These days, it really is a do more with less type of mentality, where you're able to really, provide the same level of services. It really does depend on your location, but you can do it as simply with a laptop computer and HIPAA compliant software before you really kind of jump into anything that's a little bit more expensive in how you would expect telepsychiatry services to work. Designing the workflow is also extremely important, and I would like to tell people what they're trying to, have a telepsychiatry program internally, or if they're looking at a third-party vendor, designing the workflow is extremely important. But however, it should mimic your existing psychiatry workflow as much as possible. There's really no sense in reinventing the wheel unless you absolutely have to. That way, it's you're really getting buy-in from the staff that would be using it. Also, the providers are basically mimicking and providing the same type of workflow as an existing provider would. So that would be a strong recommendation that if you can, mimic what you guys are currently doing, that's a great way to go about it. Provider credentialing is definitely a large one. And this is one of the obstacles that it does definitely take some time, and we'll talk about that later. But that's something to really, have a good handle on before you dig too deep into the idea of using telepsychiatry services, and more in particular in terms of thinking about your timeline. I think I personally speak to many folks each week, and sometimes people say, I lost my on-site psychiatrist. I want to start telepsychiatry next week. And unfortunately, I have to be the bearer of bad news and tell them that as much as I'd like to start next week, unfortunately, there's really a lot that goes into launching a successful telepsychiatry program. And then after I kind of talk about some of these points, they do start to understand. There are, I think, groups out there that do start very quickly, and Insight, we have started quickly. We've been able to start in a matter of a couple weeks before, but we have personally found if you don't take the extra amount of time on the front end, throughout implementation, you will hit some roadblocks, after we hit the go live button where, they actually start to see patients. And then there's always those couple gotcha moments that could have been avoided if you would have taken the additional next steps in, during the implementation to, cross off some of these on your agenda. And then also the training, the training kind of goes both ways. So the training of your on-site staff, where they would understand the workflow totally. They would understand how to operate the equipment in terms of how they could access their provider. But then also the training goes the other way as well. It's very important to train your psychiatrists. If you're going to be having a telepsychiatry program internally, you really want to educate them on the workflow and, obviously what schedule they're going to be working, or if they're going to be on call for a hospital, how are they going to be navigating your electronic health record remotely, just to make sure all those expectations are clear. Also, in terms of the training, we'll talk about kind of best practices for providers and organizations alike here shortly. Knowing the state-specific regulations and rules is obviously very important. And, here we're talking to folks in the Midwest, but every state operates a little bit differently, which is understandable. Every license in each one of the states, is a little bit different. It's important to have a good relationship with the state medical board and kind of how they view telemedicine and telepsychiatry specifically. Reimbursement is going to be, different really whatever state that you look at. Hopefully down the road, it'll be a little bit more similar from one state to the next. Medicaid, and the folks that are on the phone today, Medicaid is a pretty favorable payment source, whether you're in Michigan and you run primarily on Medicaid dollars, or if you're in Wisconsin and Badger Care is one of your larger payers. It's all pretty favorable to reimburse for telepsychiatry. Private payers, that one is a little bit different. Every state is a little bit different in terms of how they will reimburse for that. But that's also something that, if you guys have a question later on after this presentation, and if you were to come to me and say, we've got, we got some Medicaid, we've got some Medicare, and, how does private pay work in my certain state? I'd be more than happy to help you kind of pinpoint that. And that's also something to know, throughout this presentation. I definitely want to be a resource to you folks as much as I possibly can with any questions that come up. So please don't hesitate to reach out. Also, the physician-patient relationship and prescribing, that's a little bit different with every state that you look at in terms of what does a physician actually need to do to create a physician-patient relationship before they can actually start prescribing. So that's something that it really does differ state by state. Also, we have to look at the telemedicine specific legislation and regulation, permitted to the services and professionals, and what the site needs to be licensed as, and things of that nature. So I would imagine that all of you are fairly familiar, and if you're not familiar, with the Interstate Medical Licensure Compact. In brief, and there's really a lot that's been going into this. It's an expedited licensure pathway. So if the state of Michigan, for example, if they are lacking psychiatrists, there's a good chance that providers that are physically located in Illinois and Wisconsin, Indiana, they would be able to get an expedited license to be able to provide telepsychiatry services to Michigan, because all of these states are all part of the compact. The goal here really is to increase the access to healthcare of individuals in underserved and rural areas and allow patients to more easily consult medical experts. The bonus here is the compact increases the opportunity to utilize telemedicine technologies, which is great. And I know that Becky's going to be sharing this PowerPoint and this presentation with you, so I'm not going to spend the time to watch the video, but this is just a little video for you to better understand exactly what is the Medical Licensure Compact and the future of it. I mentioned reimbursement earlier, and as it's very important with many of the organizations that we work with. If the state is considered rural, Medicare will reimburse, and I think that's one of the big drawbacks with telemedicine, and hopefully in the future we'll see some changes with how Medicare really accepts the idea of telemedicine. 29 states have legislated private payer coverage, which is great, and I think that's going to continue to grow. And also 48 state Medicaid programs have some type of coverage for telemedicine, which would include telepsychiatry. And Becky and her team is also another great resource here to really understand how reimbursement could impact the state which you reside. I touched on this a little bit earlier, but to really kind of cultivate the stakeholder buy-ins, we're talking about if it'd be one thing for me to, introduce telepsychiatry and have, one, C-level professional say, hey, this sounds great. I'd like to, have this put in place in my hospital. But it's really a lot larger than that. And there's really a lot of, pieces of the puzzle and moving parts to really launching a successful telepsychiatry program for any organization who might be interested in this. You really need to get buy-in from the providers who are on site. For an example of this could be, let's say that there's a hospital emergency department, and we all know that in many cases, folks that are suffering from a psychiatric illness, where do they go most of the time? They go to the emergency department because they really don't have any other options within their community. So they might end up in the hospital emergency department, and this would be at a time of crisis. And the ED physicians, they're, for the most part, they're pretty comfortable in treating the mentally ill. But if they knew that they had access to a psychiatrist through teleconferencing, there's a good chance that they, might, use the telepsychiatrist, at those times when disposition is unclear. Do I admit this person or do I send them home? Is this person really showing the signs that they might, hurt themselves or hurt other people if I do discharge them? So a lot of times they're admitted, but if the ED physician had access to a psychiatrist, the decisions on that might be a little bit different. Really kind of getting buy-in from some of the executives that all you folks work with is also extremely important. They can really do some hand-holding and educating internally on, how telepsychiatry is going to, positively impact that, outpatient clinic or that hospital or that county jail. And then also the IT component. We work with a lot of, IT groups within, many different settings, and, they are, extremely important to really work with. So our systems can work with your systems. And that'd be the same for, if you were even thinking about having a telepsychiatry project internally, you'd really want to be able to set up the provider and their equipment and their internet, and the speed of their connection. It's really important to, do some educating with IT and have them really be on board for any telepsychiatry program. To get buy-in from medical affairs is extremely important. As I mentioned previously, that's a big part of this. This is, It's all the information gathering. It's really working behind the scenes to let providers be able to work effectively in many different settings. We're talking about the credentialing of providers at that facility. We're talking about the paneling and the privileging of those providers in, like, let's say, hospital settings. It's really, them, kind of being the go-between in many cases between healthcare organizations and the provider. So it's always running behind the scenes, but if this part wasn't in place, the providers would never be able to see patients. Also getting buy-ins from communities. It'd be one thing if, an outpatient clinic, let's say like a community mental health organization had a telepsychiatrist to strictly see their Medicaid patients. But if there is some primary care physicians, within the community, if they would know that there was a psychiatrist available over at that community mental health, there's a chance that would be a good way to remove silos and improve access to telepsychiatry throughout your community. So it's really nice to get that buy-in where, primary care physicians and the physicians at, urgent care and ED physicians and, whatever level of professional at any of these settings, where they really understand that, we do have access to a specialty provider and it's not 6 hours away. It's in our own community. So having that community buy-in is extremely important. You really want to be able to select your providers. And I'm just going to speak for insight here. It's really about finding the right provider for your exact needs and your organization. To be able to find the right psychiatrist that maybe shares your mission and your philosophy, and kind of how you guys operate within your organization. The right prescribing philosophy is also very important. Bringing in the specialty is obviously, one of the most important things, whether, child and adolescent or geriatric or substance abuse is also important. But also to look at, how do they culturally mesh with your organization? That's really important. You really don't want to be in the game of just putting any provider in place just because you need psychiatry that badly. Bringing in the right provider that ultimately it's almost like you'd want to hire them as if they walk through your clinic or hospital doors on Monday for an interview. You really want it to be, that type of blending of, bringing in that type of provider into your organization. That way you're not going to have a round robin and swinging doors of psychiatrists coming in to work for your organization, because ultimately that's just too much work for everybody. So if you take the additional time to find the right provider for your organization, there's a good chance that you will hold on to them for a very long time. I know that some of our organizations here at Insight, we've taken done our due diligence to, take those extra steps where we can, we've had the same providers sometimes that have been working for that same outpatient clinic for 6 and 7 years. So it's always good to just kind of take that extra time to bring in the right provider to your organization. And I don't need to spend too much time on this because I already kind of touched on the importance of medical affairs. But you really need to think that this is going to be the most time-consuming piece of any telepsychiatry project that you might launch within your organization. So definitely think ahead on that. Also take a look at your bylaws to make sure that they're conducive to telepsychiatry. And also, is your organization willing to credential by proxy? Because if so, that would definitely speed up some of the time. But again, just take a look at the licensing, the credentialing, the paneling, and the payer enrollment. Figure out who your largest payers are and how they view telepsychiatry, and also the maintenance of certification and reappointments and CMEs and such. Picking the right equipment. So as I mentioned, 4 years ago, this is the kind of equipment that if I was speaking to, some C-level folks at a hospital setting, this is the kind of equipment that I might recommend. And I say recommend because here at Insight, we are not a technology vendor. So many cases we can, outsource, a contact where you might be able to purchase something like this. But, these days it's really about, finding the right piece of equipment that is going to work for you. So maybe some questions that you might want to ask yourselves is, do you want your telemedicine equipment to be mobile? You can see in this picture, this piece of equipment has wheels where it could go within or into an emergency department and go from bed to bed to see the patients that are suffering from a mental crisis. Or if you want to have, have a piece of equipment like this be carted around by, let's say, a nurse in an inpatient unit. That way they can also do some rounding on the unit and go directly from patient to patient. If you might have a dedicated telepsychiatry room, you might be able to get away with just having a desktop unit, or even like a laptop computer with the right software on it, where it's more stationary, and it's also, you're really not, the financials is quite a bit different. I've seen equipment that is similar in this picture. I know a used piece of telemedicine equipment can be, let's say, $4,000 to $5,000. But then I've also worked with hospitals that have purchased units that are upwards of $20,000 a piece. So it really kind of comes down to being as fancy as you want to. But I would definitely encourage anybody who's interested in this to really start small instead of jumping in head first with a purchase such as this. Designing the workflow that really works for you. So proactively design a system that works for you, and the goal should be integration. When will you use telepsychiatry and how? And who will take the records, and how will they be sent? And who will be the facilitator? Just to kind of touch on the key here of the facilitator, or I also like to call them the boots on the ground. This is the person that, let's say we're in an outpatient clinic, and this outpatient clinic uses telepsychiatry. The facilitator is the person who goes and will get the patient out of the waiting room. They will help with the height and the weight, and they'll check the vitals. They will basically kind of quarterback the total encounter between the patient and the physician. They will update the physician on what's been going on with the patient, if there's been any ill side effects that the provider would like to know about before the patient is seen. They will also assist the psychiatrist or the APN in terms of if there's going to be a prescription change, or maybe if the provider would like to request some lab work. That person is really going to be able to help with, educating the provider on some of the resources that might be available within the community. So if the provider might say, I think that this person would benefit from spending some time in, a residential facility or an inpatient unit, this person who is the facilitator might know some of that information. And then also, how will the scheduling work? The idea here is that the schedule would really kind of, work with, whatever's best for that organization. If we're talking about an outpatient clinic, I would suggest probably having a set chunk of hours for that outpatient clinic to have the telepsychiatrist providing services. If you are looking at, let's say, a hospital or a healthcare system, and we all know that mental health really does not, run on a time clock. We never quite know when a patient might end up in the ED. You might look at it and say, well, you know what, I think we probably have all of our bases covered during business hours, but it'd be really nice if we could have telepsychiatry access on nights and weekends. So you really just have to kind of look at, what's the best schedule that is ultimately going to work for your organization, and then how will telepsychiatry impact that? Training the providers is it's extremely important, and it's really about the best practices. What we found is it's really important to there's some folks that come to us that have an understanding of how telepsychiatry works. Maybe they've already done some telepsychiatry, but also sometimes they need to be trained from the very beginning. They need to understand that having a calm environment, not having anything too distracting in the background, avoid certain noises. We had a provider at one point that his cat kept jumping up in his lap during the clinic days. And we had to tell them, it's kind of inappropriate to have your cat jumping up in your lap when you're seeing patients. It's just more of a distraction than anything else. Sometimes people don't care, but some of the other patients, found it a little inappropriate that a cat was jumping up in a psychiatrist's lap. So all just something to kind of take into consideration, when you are starting to train your providers. And putting telepsychiatry in its place, you want to make sure that all the parties know why and how telepsychiatry is being used. It's really, I can't say this enough, but it's really not about replacing on-site cares. or the on-site care of your on-site providers, but to simply augment and blend with what you folks are currently doing. And I've danced around this a little bit, but demystifying the technology. The technology really should not be the focus. It's really about the clinical care that is being provided. You want to be able to conduct your orientation and training via televideo to get each side used to it. And problems are generally just the user error. I know that we have found that if we can provide the IT support to not only the organizations that we work with, but also the providers, we can be back up and running in a matter of minutes. So I would suggest that you have, kind of that backup plan as well, should you have any issues with your technology. This is also fairly important. Telepsychiatry practices to avoid, insecure and unprotected video and documentation platform. You want it to be HIPAA compliant. You want it to be safe for the patients and the providers and your organization as a whole. You also want to avoid a slow internet connection. For example, just for the purposes of this presentation, I'm on my Wi-Fi connection, but if I was a provider, I would actually be hardwired into, where I'd actually have a very strong, internet connection. Less chances of having a pixelated screen or a frozen screen where my face would be frozen kind of a goofy manner. That way the sound quality also would be, matching when my mouth moves. So it's important to have the strongest internet connection possible. You also want to avoid the provider not being licensed to practice in the consumer state. And that's a universal precaution. Make sure that any provider who's going to be providing telepsychiatry services is licensed in the state where your clinic resides. The distracting visuals in the background, for example, the cat in the provider lap, avoid things like that. And also, the distracting sounds. If you're holding a telepsychiatry clinic, this goes for the provider's not going to be providing telepsychiatry services as they sip on their coffee at Starbucks. And then also, we wouldn't expect that, the provider would be providing telepsychiatry services, let's say in your ED, where have lots of other family and friends around, with lots of distractions. You'd really want to make it a little bit more secure for that patient. Close the curtains in the ED, have a dedicated telepsychiatry room. Just do the absolute best you can where there's no other patients around, just to really be able to focus directly on that patient-physician relationship. Some telepsychiatry practices that are appropriate is to have a technology backup plan. We all know here in the Midwest that sometimes we get bombarded with snow. And so if the teleconferencing equipment might have some glitches, maybe you can have a backup plan, whether it's having an extra laptop computer with the right software on it. That's always a good idea. Maybe you can use the telephone just simply for telephone consults that day, but just more or less just to have a backup plan, because sometimes things do happen when using telemedicine. Having emergency contact numbers and emergency numbers of the consumer's area is also very important. Have the providers review the consumer's information prior to the first session. That way they can jump right into it. Sometimes in terms of scheduling, if we're talking about scheduled services in like an outpatient clinic, it might be a good idea to send all of the patients that the provider is going to see that day, or sometimes you might even be able to give the provider maybe 10 minutes in between each patient. And we all know that you'd want the provider to see as many patients as clinically possible, but you also don't want to burn out the provider and let them feel like they're not ready to see a certain patient. So if you give them some time in between patients just for reviewing purposes, I think that's a strong idea. You could also have a white noise machine, or for ambient noise. Check your video presentation beforehand, just to make sure that the provider is kind of presenting on their equipment the way that they would like to be presenting, and the same thing goes for your organization as well, just to make sure where the patient is actually going to sit, and then also where your equipment is going to be. Refer to another telebehavioral health provider or in-person provider if necessary. So for example, if even telepsychiatrists, they get sick sometimes as well. So if there's a chance that patients on that caseload could be sent over to another level of provider, if something like that is to happen, that would also be a pretty good idea. And then obviously the provider would be trained to practice telebehavioral health before seeing any patients. So those are appropriate telepsychiatry practices. Start to know the community and know the culture of the organization and its surrounding areas, and know the resources available. These are the kind of things that you want to educate the provider on before they start. And this is actually a good step throughout implementation. You might have a teleconference specifically just to kind of talk about what is available within the community and where the referrals coming from. If you might want to get buy-in from I mentioned the primary care physicians earlier. You want to be able to have the provider know about the very closest psychiatric inpatient unit. Does it only take adults or does it also take children? That way the provider, they can have all of this information before they start seeing patients, and also in collaboration working with that facilitator that I mentioned. Before they know it, even if your clinic is in Illinois and your provider is in Texas, before you know it, that provider starts to know the behavioral health footprint within your city and community. And so they can be able to know exactly where all of the resources are, even though they're not physically located in that state. And also, get to know the team that supports telepsychiatry. Get to know, all of the folks that the provider's actually going to be working with. From all of the nurses and the facilitators, and the therapists, social workers, and case management teams. It's really important to build those relationships, as I mentioned previously, with the teleprovider and your on-site team. And before they know it, it's almost like they're just a member of your team, but they just show up 8 to 16 to 24 hours a week to provide telepsychiatry for you folks. And then before we know it, you go ahead and you launch. And so I mean that's an awful lot. Honestly, the standard implementation that we've seen happen, a good estimate is anywhere from 90 to 120 days. And I hope I touched on enough for you guys to understand why it might take 90 to 120 days. I know that seems a little daunting, but there really is a lot to go into it to make it a success, to really get buy-in from everybody within your organization and your community, all the way from the training and picking the right equipment. It's really important to know that, your organization, could use telepsychiatry different from the organization down the road. Everybody's different, and there really should not be a real concrete way in how telepsychiatry is provided, but really more or less about how it would work for you in your organization and your patient population. So that's it. We were able to get it all within the hour that has been allotted. I guess I would like to turn it over. If there are any questions, I'd be more than happy to answer them now. Also, Becky does have, all of my information that she can share with you, and she'll send out this PowerPoint. But all of my information is right there. If anybody has any questions, not only just about how Insight operates, and maybe how Insight could, affect your organization, but just more in general, how could telepsychiatry work for your organization? Or if you have any questions about, the reimbursement or the bylaws, I'd be more than happy to help you. I know Becky would be more than happy to help you. I just really want to be able to be a resource to all of you folks.
Thank you so much, Randy. You covered a ton of information, so I know people are going to be watching the recording to get some more in-depth stuff. We already do have one question. This is information is good. I'm seeking a vendor partner. Does Insight currently provide coverage for CMS designated intensive outpatient geriatric programs?
We do, and see, that's kind of that's a really nice question. So whoever asked that, thank you. That is a very specific program that you'd be looking for. And so, I mean, I'm not sure where that question came from, what state or what organization, but I imagine trying to find the provider who specializes in that specific service that's being requested, it might be a little bit more difficult. And so that's kind of the beauty of telepsychiatry in general is, here at Insight, we are able to recruit nationwide. And so we can make sure that we find the right provider for the right organization that would really kind of meet the vision that organization in terms of how telepsychiatry would be provided. And then obviously you just need to ensure that they are licensed in the right states, and they jump through all the hoops that we mentioned, during implementation. But to answer the question, yes. And that's exactly what we do is we partner with folks that have very unique needs. Some of them are, some run-of-the-mill kind of vanilla services that are being requested, but so important. And then other times people come to us with very specific needs where their community has a very difficult time recruiting for that type of specialty. So that's one of the beautiful things about telemedicine.
Right. And then the other part of their question is, do you have a specific platform that you use?
Mm-hmm. The idea here is, that we would really be able to work with existing teleconferencing equipment that is already in place. And that's more of, talking about the equipment. In terms of the platform that we use, all of our providers actually use a software. It's called Jabber. It's actually a software of Cisco. So I imagine you folks have heard of the company Cisco. All of our providers use that, and we're also able to share that with the clinics that we work with. The nice thing about that is, our information technology team, they know Jabber like the back of their hand, so they can provide IT support to not only our providers on that, but also all of the partner organizations that we work with. Jabber is extremely easy to use, and it's also HIPAA compliant, which is obviously the most important thing here.
Right, absolutely. All right, I don't have, I was all set to ask you about the licensing compact, but you did a great job touching on that already. I don't have any other questions at this point, and we are right at the top of the hour. So Randy, I want to thank you so much again. This is great information. Really appreciate you speaking to our audience today. And as we indicated at the beginning, we will be sharing the recording. I will send an email out to everyone who registered once that is available. We should be able to get that up within the next week or so.
Wonderful. Well, thank you again, Becky, for working with me in the last minute glitches on trying to get this presentation up and running. So I really appreciate it, and I can't say enough about your organization and what you're doing to really help be a resource to a lot of folks where this is really new to them. So thank you for letting me have a chance to really talk and drill in to talk more about telebehavioral health. It's been very beneficial. I hope you guys found it educational, to really kind of understand what you need to look into before really digging too much into telepsychiatry and to really make it a success for your organization. So thank you, everybody who joined us today.
Thank you very much. You guys have a great rest of your day.